All right. In the interest of time, I'm going to go ahead and get us started. I think a few more people will join, but super excited to have you all here this morning. My name is Haley Bell. I'm the training program manager for Telehealth ROCKS, and I get to facilitate today's session. We're super excited to have you here for the seventh session of our Echo-like training series, supporting the whole child, connecting brain health systems and practice. Next slide, please. All right, so I'm super excited to get to introduce today's speakers. So first we have Melissa Maris. Dr. Melissa Maris is a clinical community psychologist who recently joined our team here at Telehealth ROCKS as the Director of Community Health Services. So in this role, she provides primary care teleconsultation and oversees the team's community health services funding with a primary focus on advancing WISC implementation and partnerships. Dr. Maris has spent nearly 25 years working on systems level change efforts to build capacity among schools and other youth serving agencies to increase access to quality health and mental health support. So thank you so much, Melissa, for joining us. Super excited to have you. And then we are also joined today by Shelby Nace. Shelby is a social worker by trade and a big feelings person at heart. So with over a decade of experience across public education, child welfare, nonprofit grant management, and trauma-informed therapeutic care, she brings compassion and grounded presence to her role as a staff wellbeing coordinator for the Park Hill School District. In this role, she toggles between developing innovative mental and emotional health programming that's accessible for all district staff and also offers one-on-one support for staff navigating the well-being landscape, both inside and outside of work. So super excited to have you with us today as well, Shelby.
Awesome. Thank you so much, Haley. And hello, everybody. So excited to be here with you this morning. And thank you all for being here, especially because we are nearing the middle of July. And especially for our school friends, I know that this is a challenging time. Not a challenging time, but maybe not a time that you're hopping on a Zoom to talk about staff wellness. But super excited to be here and can't wait to hear from Shelby as she shares some about her experience in Park Hills. Before that, I'm just going to talk a little bit about staff school wellness. If you all are here, I know that you believe too that adult wellness matters in schools, but just kind of to run through these. We know, of course, that adult wellness is a foundation for school success overall. Adult wellness supports staff retention. It creates positive school climates that do benefit students. There's lots of research showing that well-supported adults are linked to positive student outcomes. And those adults, when they are well, can build strong relationships, manage classrooms effectively, and enhance student learning. We also know that adult wellness in schools is really important in terms of part of the workforce strategy. Wellness and school wellness support for staff is regularly cited by folks working in schools as being as important, if not more important, than pay, which also improves recruitment and retention. And we'll talk a little bit more about this here shortly, but certainly our school workforce is a constant focus of how we can continue to support the well-being of entire school communities, children and families. If we don't have a strong and well workforce in schools, then none of it's going to work. And then finally, really thinking about a sustainable system approach. And so framing wellness as an essential infrastructure encourages long-term system level support for faculty and students. So kind of looking back, and Shelby and I were talking about this just last week of kind of where we've been with school wellness and kind of where we are. I'm sure many of you all have had different experiences in these realms, but thought it would be helpful and maybe just kind of fun to walk through it. When we look back sort of the last decade, so thinking about 2016-ish until now, and we look at those early wellness initiatives. So when staff wellness, it seems like was kind of first starting to gain traction. This is when school wellness committees were starting to get formed. And at least in my experience, a lot of those early efforts really focused on staff or employee wellness. But a lot of those initiatives were very individually focused. And so doing things like fitness challenges, stress workshops, wellness fairs, having a professional development devoted to kind of the stereotypical self-care, so a massage chair or having somebody come in to lead, a Zumba class. And that was really kind of the focus at that time. And since then, there really has been a shift to an organizational focus. And from my experience, this was really kind of in reaction to feedback from school folks and then other folks who said, it's not very helpful to tell, stressed out teachers that they should just take care of themselves and that everything's going to be better if they can just walk around, the track a few times during their lunch break. And so just, kind of some pushback around that, and also a recognition that organizationally and at that organizational level, it's helpful and important and really economically sound to look at the organizational focus, and really that it's very, very difficult for individuals to focus on wellness when the organization isn't there supporting them. And this, of course, is true not just in schools, but in all organizations. And so looking at how the context could really support the individual actions, not in any way taking away from those individual actions. I love a good wellness fair still, but also what's going to happen the day after that or the next week. How will this happen next year? So this question around sustainability also started to come up. We also started to see a really strong focus on incorporating psychological safety. So a lot of this happened through Trauma-Informed Schools initiative and other areas, and looking at staff voice and choice, looking at SAMHSA's 3T trauma model, and trying to figure out how to incorporate these different components of safety, empowerment voice into school wellness approaches. And so, I think probably all of the trauma-informed schools work that I ever did always had a focus somewhere in there on staff wellness, which was certainly a shift from kind of, the 10 years before that really was focused solely on student wellness, and kind of the staff wellness was a little bit of an afterthought. And then finally, certainly the pandemic-driven awareness. And so we're going to talk about this a little bit more in a second. But COVID-19 really did highlight chronic stress and emotional exhaustion, and also created a lot more resources outside of schools that schools very quickly picked up on and started to incorporate into their own policies and processes and programs. And so kind of thinking about this, we go from healthy teachers support healthy and successful students as being kind of the sole focus, to this shift towards staff wellness impacts overall organizational functioning, and really looking at workforce shortages as a significant challenge to public education. And then also kind of looking at the bottom line. And so looking at money. It costs a lot for schools to recruit and retain teachers. And so that staff turnover does have a dollar sign attached to it. And so talking about that or thinking about that from my perspective doesn't make it gross or dirty. It's just real. And also we know that numbers, so student outcomes and dollars, often are driving or very much informing kind of decisions at the district level and certainly at the state and national levels. And so talking about those numbers and how it's connected to staff wellness makes a lot of sense. And then finally, looking at trauma-informed efforts that really focused on everyone in the school community. So we've always in schools been focused on the children, adolescents, and then certainly family engagement, but also that recognition that the adults in the school are also part of the school community. And just wanted to highlight one of the kind of ahas for me kind of early on in this work was in rural schools and communities where you really do see, and not that it doesn't exist everywhere, but you really do see, that the teachers have kids who are in the school. And so they are both staff and families of those students. And then over time that those students grow up and they come back to teach in the school. And so it really is kind of all interconnected. And it's been really fun to learn with and from a lot of rural schools and kind of look at what they're doing in those ways. So in terms of kind of some general recommended practices for staff wellness, you can see these here. I think one of the things that perhaps is a take home for me is that the same things that support student initiatives, student wellness initiatives, student academic success initiatives are the same things that support staff wellness. So of course, clear leadership commitment, and certainly from the top down, bottom up, side to side. It really does look different when a school leader is committed to wellness. They talk differently, they act differently, they make different choices, and have different conversations, and what they prioritize is really different. Certainly, staff engagement. So we see now a lot more engagement of staff in terms of getting feedback around what staff really need and want. And that helps in terms of engagement, buy-in. Um, really looking at mental health support. And so not just looking at physical wellness, but kind of this more holistic perspective, not just for the whole child, but also the whole teacher kind of idea. Also, talking about mental health support in any way normalizes mental health challenges, and also continues to address stigma, which we all know is still very prominent in terms of a barrier, really, in addressing mental health challenges in our communities, and organizational conditions. So, kind of recognizing that how we structure our days and how we structure our buildings and kind of those sort of infrastructure pieces really does matter. And so thinking about how we can look at flexible scheduling if that's a possibility, things like that. And really even like pretty basic things you would think of, if a teacher is in their classroom and they're the only adult there, what do they do if they need to go to the bathroom? Like, how do we support that? Can we have something like a floating sub who can really just walk around and support teachers and say, hey, I can stand here and I can be here for a few minutes if you need to go take care of things, check in on your family, go to the bathroom, take a walk, and those sorts of things.
Thank you so much. And I love how we've kind of done this big overview of what staff wellness looks like, or is kind of a broad overview. And now I'm going to kind of zoom in a little bit and explain sort of what my role is in my district. I'm a little bit biased, but I feel like we're doing a lot of really good things. And so I'm really proud of that. And I'm kind of excited to share that with you guys. So just to give you a little bit of background, so I'm Shelby, I'm a social worker by trade, but I am the staff wellbeing coordinator for Park Hill School District. We are a suburban school district. We're north of Kansas City, Missouri, in southern Platte County. So I'm giving you like just a little bit of what we look like on a map. We serve approximately 12,000 pre-K to 12 students within 2 comprehensive high schools. We have 1 innovative personalized high school program, 4 middle schools, 12 elementary schools, an early education center, and 1 therapeutic day school. And then within that, we also have about 2,000 staff members. That's, fluctuates day to day. But that's about 1,000 certificated staff. And then we have roughly 1,000 support and operational staff. So that's just kind of an overview of what we're looking at here. And I was really lucky when I came into this role last year. So full disclosure, I've been in this role for 1 year. It's a brand new position. But prior to this, we did already have a really robust employee wellness program. We had a health enhancement coordinator who runs our fitness center. She kind of coordinates our annual health screenings, a lot of district-wide health challenges. She does metabolic testing for our staff when they request it. And then at that time, she was also kind of in charge of promoting our employee assistance program. So she had a really big job, and most of that program was really aimed at helping our employees manage their physical health and wellness, which we know that there's, mental benefits to that as well. But again, primarily focused on that physical health and wellness. And that role, the health enhancement coordinator role, had been established in 2008 when our district opted to put in our employee fitness center, which is on site at our district office. It's pretty small, but it's still, we're proud of it. And so again, I was walking into a program that had a really, was really robust and well established. We also had a pretty comprehensive benefits package that was subsidized by our Board of Education. So they were doing a lot of things right already, but they were still finding that a little bit more was needed. So we can go to the next slide. So several things preempted this addition of a dedicated social worker for staff. not one of those things being COVID, right? So we kind of came back from COVID-19 and started kind of quote unquote getting back to normal, right? Whatever that looks like for us. Um, but we were finding that staff were coming back with a lot more mental health issues, and there was a lot more talk about burnout and stress. We also, as a district, just experienced several years in a row of really big district-wide tragedies. So we had student and staff deaths, and that was really tough on our staff and our community. Our community is a big part of our district. We have a lot of teachers who live and work and whose children go to schools here. So we're really kind of integrated, and we had a lot of big events that really feel like they rocked our school district and had a big impact on everybody's mental health. Along the same lines, we also around that time began the rollout of restorative practices in our district, which I'll talk a little bit more about that later, how that sort of influenced a lot of what I aimed to do when I got here. But we were already kind of headed that direction of learning that the adults really needed to embrace this work just as much as with themselves as with the students. But all that to say, we were finding that we really needed more in terms of employee mental health. So our health enhancement coordinator, that role that was very focused on physical health, she was getting really bombarded with a lot of questions and a lot of people coming to her with these big issues. And she said, well, part of this, I worked in corporate wellness. Like, I do not have the background for this. And I really appreciate that she was like, this is more than I can handle. So those conversations started happening, and luckily we were, I'm again really proud of our board and our leadership because they really embraced the need for this as well. So after several years of working with various district teams, we put together this, or rather they put together this job description for the role. So what they wanted was someone who could promote and provide access to staff wellbeing resources, collaborate with stakeholders to support employee wellness initiatives, offer short-term emergency support to staff in need, educate staff on a variety of wellbeing topics, manage and mediate workplace conflicts, and respond to critical incidents. The goal of the role was to really foster a supportive work environment, cultivate meaningful connections among the staff, and build a strong sense of belonging in the district. So that's another big thing with our district that we emphasize quite a bit with our students and staff is that sense of belonging. Next slide, please. Okay, so then when I came in, what does that look like in practice, right? We have all these big ideas about these different aspects of the role, but what do we want that to look like? So right after being hired in the role in July of 2025, I began this process of strategic planning. So taking the framework provided by the district, I drew from a variety of tools, which there's some links to a few things that we can throw in the chat here whenever we get a chance. So one of those being the Missouri Department of Mental Health's framework for mental health and employee wellness. We took some of those kind of big pieces there. We also used Wellness Alliance's 7 benchmarks for workplace wellness. And then that's formerly, it used to be called WellCOA, but now they're the Wellness Alliance. So we use a lot of their resources as well. And then again, we also pulled from restorative practices quite a bit. So we wanted this role to look a lot like our restorative practices did in school. So being able to have those sit-down conversations with individual people, with groups, to be able to kind of really hear what people were needing. So I spent a lot of time in those first few months listening to district leaders, forming community partnerships with other agencies in the area that I could refer out to, surveying the district. We're already kind of notorious for surveys, but we sent out a lot of surveys, and really just trying to make an effort to get this position out, like letting people know that this existed. So even now, being here a full year, like I feel like I'm constantly advertising, like, hey, this is a service that we offer. And people still are like, oh, I didn't know we had that. And I'm like, okay, no one's reading my newsletters. But people are, and it takes a while to get the knowledge out there and that sort of thing. And that's just part of it. So what this ended up sort of looking like were me being able to offer individualized staff wellbeing appointments. Those appointments oftentimes include a needs assessment, identification of resources individual to that person. A lot of times we make self-care and safety plans if they're needed. And then we navigate sort of mental health options for staff within school. So maybe using our EAP program, or maybe being referred out using something that takes our insurance that we offer, looking at different options that way. And then just talking through specific challenges. The thing that I found is that most people just wanted to be heard and wanted to have their individual needs met. So that is a big job with 2,000 staff members. But again, not everyone takes advantage, and it's kind of a word of mouth. A lot of times people say, oh, I had a really good appointment. She was able to help me find this and this. And it kind of spreads that way. We also, again, do a lot of showing up at staff meetings, showing up with new teacher trainings, different things like that. But then we put out a monthly newsletter. So a lot of times that includes various resources like spotlighting community resources, providing reading guides for like relevant books or wellness topics, and then different upcoming events, promoting different upcoming wellness events that we have. We've also kind of started some new programs, including on-site staff support groups. I'm running 2 of those this summer. One is for neurodivergence in adults in education. So that one's going really well right now. And then we also have a grief and loss group. Again, I provide on-site crisis and support for different critical incidents. So again, this year we had, unfortunately, another student death. I was able to be on site for that school at that time for kind of as long as they needed. I can provide professional development on a variety of different well-being topics. And then actually after next week, so I'm going to get trained in restorative conferencing, and then I will be able to do restorative conferences to kind of mediate staff-to-staff conflicts, which I'm really excited about. That should be really interesting. So I'm excited to see how that goes.